everyone. My name is Katie Brumfield, and I am the Colorado School Public Health Career Services Specialist. And today I am talking with Melissa Mouton. Melissa graduated from our school in 2013 with her concentration in health systems management and policy. Hi, Melissa.
Hey.
Thanks for joining us today. Can we just start off by what is your current job title and where do you work?
Sure. I am the founder and school leader at 5280 High School, and we are a public school in Denver, and we serve kids in recovery from addiction or those facing other mental health challenges that are related.
Wow, that's amazing. How long has the school been in operation?
This is our 4th year. So I probably started working on it. I think it was about 3 years before we opened our doors. So it's been about 7 years since I started working on it. And we're in our 4th year.
Wow, congratulations. That's awesome.
Thanks.
So how did the Colorado School Public Health help you prepare for this job?
This wasn't really the plan. I was in the combined MD MPH program and took a pause on my medical degree to take a year to get that health policy endorsement or certificate. And I just love it. I'm very involved in policy. I've always been involved in kind of the community and policy and social justice and how do you actually make change in the world. And I think for anybody who really wants to be a change maker today, you've got to have some level of involvement in policy. And so the MPH really broadened my awareness of how policies impact our health. And so it was a wonderful experience for me. And I actually considered staying in that field. I was like, no, I better go do the doctor thing. And then it was about a year and a half, maybe 2 years after I graduated, that the idea for the school just kind of came into my head and I just ignored it. I ignored it for a couple of years because I had a career path I was going down, and it finally got so strong that I couldn't ignore it anymore. So I quit medicine and started working toward founding the school.
Wow. That must have been a huge career leap for you.
It was. I mean, I'd been a teacher before.
Oh, okay. I
spent about five years in education. And then before I went to medical school. So it wasn't completely out of the blue. But, I met a 16-year-old kid who was 6 months clean from heroin, 16 years old. One of the things he had to do in order to stay off of heroin was to drop out of high school. And it's a well-known high school in Denver as well. And I was like, when I met this kid, I was just amazed. I was like, are you for real? You had to drop out of high school just to get away from heroin? He's like, absolutely.
Oh,
and so something about that it just didn't sit right with me. And I knew we could do better. And I was like, oh, I hope somebody fixes that issue. Hope somebody takes care of that. Well, then 2 years later, I guess it's me because here I am.
Yeah.
So, yeah.
Wow. That's amazing. So were you seeing this a lot as a medical provider?
Yeah. I mean, it's definitely out there. It's definitely out there. I think everybody knows somebody who's impacted by addiction, and people don't think about the kids. They don't think about the kids, but they're out there, especially in Colorado with the legalization of marijuana. Marijuana is ubiquitous, and there's this sense of feeling that it's not dangerous. And the technologies that Coloradans use to deliver marijuana today didn't even exist when it was legalized 10, 11, 12 years ago. And so a lot of our students are dabbing and using wax and shatter. And that's a whole realm of marijuana that is brand new, and it's very potent and it's problematic. So I think an issue.
Yeah, for sure. Wow. What type of medical professional were you, or what doctor? Sorry.
Well, I dropped out of residency.
Okay.
Yeah.
Okay. And then has your policy training helped you in developing this school?
Absolutely. I think, as we're a single organization. We're a 501c3. So with that comes all the things about running a business and being a public school. There's all the legislation you have to follow. And also, being part of Denver Public Schools, we're a charter school.
Okay.
So there's some things that we as a charter school have autonomy and we have to write our own policy, when other things we just do what Denver's policy is, and other things we don't have any flexibility at all. So it really varies based on what the legislation is. And if we have such a unique school that sometimes if there is something that's written into policy that isn't quite right for our student population, then we can have to go about that.
Yeah. Wow. Have you had to write grants to get funding for the school?
I do raise a lot of money.
Yeah.
We raise close to $1 million every year.
That's great. That's awesome. Wow. Gosh, I couldn't imagine creating a school or like where to begin.
Yeah, I didn't know either, but you figure it out. And I think, when I'm, if there's students out there that are going to watch this trying to figure it out, like, you don't have to know where you're going or what's ahead. Just make the decisions to go down some sort of path and you'll figure it out as you go. I mean, I'm not saying be blind when you're, don't walk around blindly, but nobody knows when you graduate from grad school, nobody knows how to do anything. It's just a big, it's just a big unknown. It's really like an undiscussed fact that, like, just because you have a master's degree, that doesn't mean you really know anything. It just means you have a master's degree and you got to go out and figure out how to do what you want to do. So
yeah, and I love how you talked about that you had this idea and it wouldn't go away, because I think that's a lot of public health professionals is they have this idea on how to solve a public health problem, and you have to follow that idea.
Yeah, I think, I know so many people, like probably the majority of my family and friends, just the majority of people seem to get a little bit stuck in their life for whatever reason. And they just never move. You never switch jobs, or you never get to know the person over here that you are wondering about, or you never make the move across town, or, there's all those decisions that people decide to make or not to make. And I think more often than not, people just kind of stay with where they're at. I'm sure there's some psychological explanation behind all this, but I'm just not one of those people. I feel like taking the action and taking the initiative and trying different things keeps my life fresh and fun, and I love it.
That's amazing. And all the students must be so grateful for this school. Gosh. Yeah, that's so cool. Are there other schools like this in other places?
There are a few across the US. There's probably about 25. Most of them are really small, like 10 kids, 15 kids. Many of them are private. So we're pretty unique in the fact that we have over 100 students and we're public and free and all that.
Over 100. That's great. And where in Denver are you located?
Kind of in Southwest Denver. If you know where the Breakfast King is, for those middle of the night snacks, we're right down the road from Breakfast King. We're at Santa Fe in Mississippi.
Okay. Cool. Well, what types of challenges have you faced when developing this school? Because I'm sure there has been some.
Huge. When you start anything from scratch, it's going to be hard, but the challenges we faced are, first off, legitimacy. Like, okay, this is a great idea, but is it really going to work? Funding, securing the funding, getting funders early on to believe in the idea, and to not only believe in it and say, oh, I love that, but also to say, I love that, and here's $100,000. That was another challenge. Getting authorized as a charter school. Nobody really in education, very few people in the education arena understand addiction or behavioral health to the extent that we have to know it here on the ground. And so that, educating people about the need for recovery schools and why we need to have a sober high school, like why these kids can't be around drugs, was a big challenge. Finding a facility was a big challenge. Like a real estate in Denver, the kind of real estate that we like, which is warehouse and that sort of space, very expensive because as soon as marijuana was legalized, you had all these grows and everything. Like, I think the price went up by like 10 to 15 to 20 times what it was before. So finding a building to be able to host a school was a challenge. Enrollment, people don't know what to do with people who are struggling with substance use. They literally don't know what to do. And so finding those people, having them know about us, getting the word out without making it sound like a crazy school, like that was a challenge. Those are some of the ones.
Those are big ones. Big ones. I'm really curious, how did you get the funding? I mean, how did you go about it? Like, how did you convince people that this was something we need and you need to pay for it?
Well, I didn't know how to do it. Like,
yeah,
I didn't know what I was doing, and I was scared and nervous just like anybody else would be, right? And I wrote down my idea on a piece of paper. It was a 1-pager. And I reached out to a local funder, a private funder. Mm-hmm. I'll give them a shout out, the Daniels Fund.
Oh, cool.
The Daniels, I had never raised $1 before in my life. Reached out and said, hey, I have an idea I'd like to pitch. Can I meet with you guys? And they set up a meeting. So then we sat on a little round table, and it was me and this guy. And he gave me a water bottle, and I gave him my little 1-pager, and we just sat down for an hour and chit chatted. And at the end of that, he gave us our first seed money. It was like $50,000.
Wow.
That was our first seed money. He believed in me. He believed in the mission and the vision. And that's what started the ball rolling.
That's amazing. It feels like Shark Tank. You're like presenting.
It was a little bit. I was so nervous. It's funny because nowadays, like, I don't get nervous about stuff like that at all. And at first I was so nervous. And that 1-pager, I'm sure I like looked over it for like 4 hours, and I was like moving little words around. I'm sure I was.
Oh, I hope you have that framed somewhere. That's so cool. So how many teachers do you have at your school?
6 teachers, and we have about 15 staff members.
Oh, so wow.
I want to hire more teachers.
Yeah.
And I think by January, we'll grow that big. We enroll about 1 to 2 kids a week. They just keep.
Oh, wow. So it's kind of a rolling basis. They can.
Yes.
Okay. That's nice.
Well, it needs to be, because sometimes these youth, these teens, they get out of treatment. A lot of times they go to treatment where they get clean and sober, and they're like on a good track. And the day that they get back to Denver, they need to come here.
Yeah.
We don't want them sitting at home. We don't want them loose on the streets. We want them here. So we got to enroll constantly.
Yeah. Wow. Yeah. So yeah, you do need staff to be able to do all that. Yeah, for sure. Do you have a career counselor? I just have to ask because I am one. You do?
We added one this year. So we gave a survey last year called the Youth Truth Survey, and it measures academics, culture, and all these other things. And we're above the national average on everything except career counseling. And so I was like, you know what? We need, looking at the data, I was like, let's get a career counselor in here. So we hired one this year, and she's working on college applications.
That's awesome.
And that sort of thing.
Good. That makes me feel good to hear.
Yeah, she's launching a big internship program where all of our juniors are going to intern somewhere. So maybe we'll put some at the School of Public Health.
Yeah, absolutely. And I wanted to ask you the same. Do you take interns, or could you ever see a public health intern?
Absolutely. Like at first I wouldn't, but like, hey, COVID. It's crazy how I never thought like my MD and PH would come in useful, but then all of a sudden COVID hit, and all the other principals around town were like calling me.
Yeah. I guess I didn't even realize that. Yeah. During COVID, God, you must have did you know kind of what the plan was right
Well, I
away.
was able, most importantly, in the early weeks when nobody knew anything,
Yeah.
I was able to get on up to date and read the literature and make some assessments, make some decisions
Yeah.
for my school. Because here's the thing about my school, these kids need to be here.
Yeah. They
When
can't
we
stay
shut
home.
down in March, when everybody shut down in March, everyone was trying to figure out
Yeah.
what are we doing? What's going on? Our relapse rate back into drug use, it increased by more than 10 times within 6 weeks. So I was like, nope, this
No.
can't happen. By the end of
Yeah.
May, I was like, we're done. So June 1st, we opened up for summer school and we did in-person summer school. We piloted it and everything was great. So then the next school year, which would have been last year, we opened up in person. We were the only high school in Denver that was open up in person all year. And I think that's, I wouldn't have had the confidence or the willingness to like grapple with those decisions had I not had my science background. So
Yeah, gosh, that MD-MPH was so valuable in this situation because it was a lot. I think it's still really hard for people to make decisions at school districts, you know.
well, the problem is you have to be able to make, well, it's the same thing with all public health measures. You can't make decisions based on like some generic thing. You have to make the decision based on the population that you're dealing with. And depending on what that population is, you can make a different decision. So for our students, there should be a very high bar for quarantining or to have remote learning. But a general population like of kids who are not struggling with addiction or mental health, sure, they can have a lower bar. But for us, it wasn't real. So I mean, just having the tools from the Colorado School of Public Health, having those tools to be able to grapple with those decisions made it possible for me to kind of tailor our program for our population.
That's amazing. That's really amazing. Wow. I was going to ask you what's an achievement or something that really stands out that you've been able to accomplish in the last 4 years, but I feel like it's that. I mean, geez.
Well,
but maybe
I'll
there's
give you
something
a little
else.
vignette. I'll give you a little vignette. We had a graduate last year. She's in college right now, attending a 4-year college with some scholarship money. 3 years ago, maybe 2.5, 3 years ago, I think it's about 3 years ago, she was a daily meth user, homeless, and she'd been doing that for like a year or two, failing all of her class. She wasn't even like going to school. So if you think about the 3-year journey that this person's been on, that's just one example of like the impact that we can have on a kid. So that's a success story.
Wow. Yeah. Gosh. I just like, it makes me teary-eyed thinking it's just so awesome that you guys are doing this. And I mean, you're saving lives.
Yeah.
You really are. I mean, this is absolutely amazing. I had not heard of this school before, but we're going to spread the word now for sure.
Yeah, y'all should. I mean, we can definitely host interns. There's always something around here.
Yeah.
Policy wise, right now, we need somebody to come over here and fix the problem with getting a juvenile on Medicaid into treatment, inpatient treatment.
Yeah.
That's a problem we need solved right now. So
yeah,
start working on that.
Okay. Public health professionals, you're hearing this first.
It's what we need. Yeah.
Yeah. No, I love that. Okay, cool. A last question. What advice do you have? You know, we do have a lot of MD, MPH professionals in our school, and some might not want to go the MD route. I have heard that before. So what advice would you have for them if they want to pursue a different route?
Yeah, I think, gosh, I got 2 things. Like, one, you're going to like one, you're not going to like the other one. One is don't be afraid to step out and try something or make a decision. I mean, you got to be smart about it and deliberate, obviously, but one of my greatest, most favorite quotes, and I didn't come up with this, somebody wrote it, I just don't know the name, is like, everything you've ever wanted is just on the other side of fear. And I really think that's true. If you can push past your fear and take the step that most people are unwilling to take, your whole life will be just like astronomically amazing. So that's one thing I think to tell people. And then secondly, is more for the current students. I don't know if they will even be watching this, but when I was at the Colorado School of Public Health, it didn't matter to me what the assignment was or what I was supposed to be doing. I just followed my interests, and that's what I did. I did the minimum. That's why you're not going to like this. I did the minimum to like get the grade or turn in whatever I need to turn in. But like, I spent the majority of my time going down little rabbit holes of policy or little rabbit holes of statistical analysis or epidemiology, like all the things that you guys have to learn about, and just take the time in school to do that research based on your interest and your passion, because it'll fill out your brain and it'll develop you as a professional in a way that will allow you to make the decisions for your life. Because if all you do is what they tell you to do when they set it in front of you, you're kind of letting your education be determined by other people. Like, take some ownership, and that would be what I would suggest. I don't know if I was supposed to say that or not, but it worked for me.
It's your advice. Well, I think that's actually really important in public health, to be curious, right? And to go down these rabbit holes. That's kind of your job, right? To help solve these big public health issues.
Yeah.
And be creative and innovative. I mean, gosh, just like what you did. It's amazing.
Yeah. Well, thanks. Thanks for reaching out. And thanks for doing this.
I'm really, really excited we got to talk today. I really appreciate you taking the time. And I'm definitely going to spread the word, because the work you're doing is absolutely amazing. And thank you so much for everything you're doing in public health.
Thanks, Catherine. I appreciate you.